at BLDEA's AV's Ayurvedam Mahavidyalaya, Vijaypura, Karnataka. He holds advanced academic qualifications including MD Ayurveda, PG, DYN, and PhD from Gujarat Ayurveda University, Jamnagar. A passionate teacher and admirer of Charak Samhita, Sir has dedicated his career to promoting authentic Ayurvedic knowledge and his clinical application. His areas of expertise include Kaya Chikitsa, Panchkarma, Rasayana, osteoporosis, avascular necrosis of femoral head, skin disorders, and Ayurvedic research. His unique ability to connect classical principles and practical clinical understanding has inspired countless students and practitioners across the country. I had the opportunity to attend one of the Sir's session at Charakayatan, Haridwar, and I was deeply impressed by the clarity with which he explained the complex concepts of the clinical relevance. It was truly enriching experience. With today's topic focusing on highly significant concept of Avaran, I am certain that we are about to gain valuable insights from one of the finest teachers in this field. Without further delay, I respectfully invite Professor Dr. Kadilamtti sir to deliver today's session. Sir, the virtual stage is all yours. Please, sir.
Thank you, Dr. Srija and Nisargavedam Foundation. I hope my audio is loud and clear.
Yes, sir.
And I have shared my presentation also.
Yes, sir, it's visible.
Okay. And is it in the full screen?
Yes, sir, full screen is visible.
Okay. So, good evening, all. This particular topic on Avarna was requested by the TGMC Bellary a couple of weeks back for their Golden Jubilee celebrations. And one of the students requested, I just presented on Avarna. Nothing like specific to diseases and chikitsa, just a concept of Avarna for 2 hours. It's on the YouTube. So when the Nisargavedam Foundation members, Dr. Srija, requested me to present a webinar for a national level for their aspirants, I thought I should give justice to this topic by adding some practical experiences, what I face in my day-to-day practice, and also to prove how knowledgeable and how genius our acharyas were to mention the unique concepts, more complex concepts of Avarna that are complicated but easy to understand when you decode it. So this inspired me to take up this topic of decoding the concept of Avarna in understanding the Samprapti and Chikitsa of certain diseases in Ayurveda. So those who have attended the previous webinar of Bellary Government College will feel that some few slides, maybe 15-20 slides are the same, but the actual, what you call the secret or actual interest will be the second part of this presentation. So without wasting much time, we will start together to decode the concept of Avarna, and we will also understand how this works in Samprapti and Chikitsa of certain diseases in Ayurveda. This is a unique concept for the new attendees of today's webinar. So these slides are very important also. It's a unique concept in Ayurveda, not found in any other science, and obviously it is related to only Vata dosha. So these are the 3 pictures that we have to understand clearly. Why did I put these 3 circles is also important. Like the first circle, you can see a blue shape of way of air and a circle. So the circle is Avaraka, and the blue way of air is Avrata or Avarika. Because many people may laugh at this slide but still I know many students will not understand what is Avaraka and Avrata. That's why to make it very easy, I put it one more figure of a balloon where air is captured inside. So air is Avrata or Avarita and balloon is the Avaraka. And if you don't understand the complex mechanism of Avarana, this concept will definitely do the Buddhi Avarana too. And it's including me many years. The concept of Avarana was always doing Buddhi Avarana to me. It's not at all possible to understand in the initial part of my life, but as I go on understanding this concept by studying Charak Samhita commentaries and also observing some patients. Today also we got a case of abducens nerve paralysis, that is the cranial nerve 6 paralysis. My students who are attending this webinar will know that when somebody asks me, so what's the diagnosis? Then I said, you just mark it as Vyanavrata Prana. And it is enigma again, but you have to mark it. So to not to have the Buddhi Avarana, we will explore the basics for a few minutes and then we'll go on to the clinical application. Why Vata dosha is unique? We all know that because we know Pittam Pangu Kapha Pangu Pangu Maladhatavaha Vayuna Yatra Niyante Tatra Gacchanti Megavat. So the Avarana differs from other doshas in many ways. This Vata differs. This is Asanghatavanta and Anavastita. It has no shape. It is not stable. It has no density. It has no mass. It has no shape. And it has no form. And it is not stable. It is avyakta and vektarupa. Karmas are vektarupa. Avyakta vekta karmacha. Not visible, but its karmas are visible. It helps in the movement of pitta, kapha, other dhatus and malas, as said earlier. And if you refer the Chikitsa 3, that is Jara Chikitsa of Charak Samhita, in Jara Chikitsa, this concept of Vayu has been explained as a Parama Yoga Vahi. Yoga Vaha Param Vayu Sanyogat Ubhayartakrit Dahakrit Tejasa Yuktam Saumyakrit Sita Samshrayat. Sleshma Samshrayat. So based on its combination with Pitta or Kapha, it acts either Ushna or it is Shita. But uncontaminated Vayu, uncombined Vayu alone, we know it is Tattarukshala Shita. It is Shita. But it is Parama Yoga Vahi. It can attain the qualities of whatever it mixes with. So it is Tantra Yantradara. Sutra 12. Vata Kalakali Adhyay. It is the only dosha which has highly praised and worshipped. Like this shloka you can see there only at the end of the chapter of 12. It has been praised with high words like comparing it to the God. Bhagavan, Prabhavascha Avayascha Bhutanam Bhava Bhava Karaha Sukha Sukhayor Vidhata. See, it's called as Mrityu, it is called as Yama, it is called as Niyanta, it is called as Prajapati, Aditi, Vishwakarma, Vishwarupa. So many words of high praise, comparison to Yama, Mrityu, Bhagavan, Vishnu, Vibhu. So this itself shows that how much importance is given to one dosha beyond other two doshas. Why this avarana is complex? Because the victim is only one. You understand what is victim? Okay, so जिसका आवरण होता है वो एक ही है. That is the covering, the covered. What is the victim is only one, that is Vata. But the avarakas are many. The avarakas are many. No, that Pitta, Kapha, Dhatus, Mala, Anna. Anyonya avarana again. So once the victim is only one and the avarakas are many, it will be very difficult to understand that which is the symptoms of which avaraka is what. That's why it's a very complex mechanism and it's a complex principle of Ayurveda. Assessment is not easy as one has to dive deep into the sukshmati sukshma parameters, the minutest parameters to understand avarana. The concept of Anyonya avarana is furthermore enigmatic. Why use the word enigma? Enigma is a deep secret. चलो हम मान भी लेते हैं कि पित्तावरण, कफावरण, धातुआवरण, मलावरण थोड़ा बहुत समझ सकते हैं, बिकॉज देर इज अ मूर्त द्रव्य, a part which is present its presence, like Rakta is visible, Rasa is visible, Mamsa is visible, Meda is visible, Kapha somewhat you can imagine, Pitta also is having a form, shape. But look into the Anyonya Avarana, one Vayu doing the Avarana of another Vayu. Both are invisible. So this is what is called as Anyonya Avarana, is furthermore enigmatic, and you may scratch your head to understand, and it is like impossible for young brains. But as you experience, as your wisdom grows, then you can understand that little bit. Because even if you see in Anyonya Avarana, Acharya Charaka also has mentioned only 12 Lakshanas. There are 20. So maybe I crack a joke to my students. शायद आचार्य चरक जी को भी बाकी आवरण का आवरण हो गया होगा, तो उन्होंने कहा कि अभी मैं मेंशन नहीं कर सकता, आप समझ लो. Based on 12 symptom, 12 lakshanas, you understand the rest 8. So he left it on to the buddhi of the Uttam Buddhi Shishyas, that I have given the fundamentals of 12 presentations of Anyonavarna. The rest 8, you decide. So this is what I always say, Charaka never spoon feeds anybody. He wants you to use your yukti to scratch your head, to dive deeper into the concepts and understand yourself. That is called as self-learning. Okay? Atma Adhyayana, Satata Adhyayana, Vadaha, like that. Avarana caused by dosha dushya malas are understood. But amurta's type, that is avarana caused by the vayu, is vayu of another vayu, is little bit difficult to understand. Now, according to Acharya Sushruta, Vata has 3 pathological manifestations. This is from Sushruta, not from Charaka. This is told in Charaka also in other words. Kevalo doshayukto va धातुभिर्वा आवृतो अनिलः विज्ञेयो लक्षणो अभ्याम लक्षण ऊहाभ्याम. Split the word. Lakshana ऊहाभ्याम. Uha means guess, logical inference. Chikitsyascha avirodataha. So Vata has Kevala Vata. This is caused by Vata dosha alone, which is called as Nanatmaja Vyadi. Dosha Yukta Vata, that is Samsarga and Sannipata, Vata Pitta, Vata Kapha, or Tridosha. And Avarta Vata, the third one is called as Avarta Vata, which is the obstruction of the path of Vayu. Now, Charaka's view, we know this in the 28th Chikitsa, Sarveshu Eteshu Samsargam Pityaddehi Upalakshayeta. Samsargam Pittaddehi Upalakshayeta. Samsargam means combination of 2 or 3. Vata Pitta, Vata Kapha, or Pitta Vata, Pitta Kapha. Why I'm telling both words here and there? Because it depends upon the Taratama Bhava. Which one is increased will taken as first. In Vata Pitta, Vata is increased first. In Pitta Vata, Pitta is increased. और मैं
I would request the participants to kindly mute their mics and switch off their cameras as well, as long as you are not having the face cam. So you may continue. Hello. Sir, your voice is not audible. Maybe by mistake you have muted your mic.
Okay, now it's audible.
Yes, sir. Now it's audible. This complete slide, I think we all skipped. So we request you to please repeat this.
Okay. The same slide visible now?
Yes, sir. It's visible.
Okay. So I said Shusha's view in the last slide, and now this Charaka's view. This is found in the Chikitsa 28. Sarveshu eteshu samsargam pittadehi upalakshayet. Upalakshayet means you have to understand the lakshanas based on the samsarga is of two, that is vata pitta or vata kapha. Sannipata is vata pitta and kapha. I told one more point if you have missed. Vata pitta, pitta vata, even though seems to be same, but why pitta is taken first is because of the taratama bhava. If pitta is more increased, then we call it as pitta vata. If vata is more increased in the combination, we call it as vata pitta. This is simple. Our second language is very important. Vayor dhatukshayat kopo margasya avarnina cha, and into bracket there is va. So if I start speaking about cha and va, some people may feel that why it is so important that one letter sir is speaking so much about. But it is very important. This proves the clinical geniusness of Charaka that Acharya Charaka has put both the words into one line, cha and va. How to understand this? The Sanskrit meaning, literal meaning of cha will be and va is or. We all know that. So the very intention of Acharya Charaka mentioning this line in both the ways is that in your clinical practice, when you start practicing Ayurveda, you will find some diseases which are caused purely by Dhatukshaya. Purely by Dhatukshaya. Vata Vyadhi caused by purely Dhatukshaya. And some diseases you will find which are because of Kevala Avrata Vata. That is Margavarna. But the fun is, you will come across certain diseases where both Dhatukshaya as well as Avarna together may manifest. That's why and is there. So these are three specific pathological processes individually and together may manifest, especially if you're treating MNDs, Guillain-Barré syndrome, and other neurological disorders. Clinical experienced staff may be there in this presentation. They will understand as they see the disease that it may be individual and sometimes it may be together also. That is why cha and va has been mentioned. Vata ke pitta kapha dehe sarvashroto anusarinaha. We all know that vata pitta kapha will be circulating all over the body. Vayureva hi sukshmatvat dvayos tatra api udiranaha. See, vayu is sukshma. So to make it angry, you need two more things, that is pitta and kapha. Udiranaha means to increase when they obstruct the path. Kupitatto samudhuya tatra tatra kshipan gadan. So this angry vata, pitta और कफ को इधर उधर फेंक के तत्र तत्र क्षिपन गदान will throw the pitta and kapha here and there while circulating. This concept is nothing but yatra sangha ka vaigunyat vyadis tatropajayate. Karoti avratamātkatvat rasadimscha upashoshayeta. See, when pitta and kapha or other things do the avarana of the marga of vayu, then rasadimscha upashoshayeta. Rasadi means all the dhatus malas will be dried away. Upashoshayet means they are such respective diseases will be caused. Is the meaning of this one. Now, if you look at the commentary of Chakrapani for this shloka of Charaka Chikitsa 28, Pittyaderiti Pitta Kafarakta Purishadibihi. See, Pitta, other two doshas, Raktadi, Dhatus, and Purishadibihi, malas also. Ata Avratasya Vayo Katam Kupitatvam Bhavati. Means question he asked. Avrata Vata, how can it be Kupita? Yavata Avrato Durbalaha. See, until unless the Avrata is Durbala, the symptoms will not manifest. Dhatu kshayaditi sarakshayatvat. That means dhatu, literally dhatus will not attain kshaya initially. The best wonderful example is the first word is shosha, then is kshaya. That means first the sarabhaga kshaya will take place. Then if you don't take treatment properly in the right time, this sarabhaga kshaya will lead to dhatu kshaya itself. Now the actual kshaya of the dhatus takes place. So margavarana, this a yellow marked in the fourth line, maybe my cursor is visible to you. Vega pratibandadeva kupito bhavati. Vega pratibandadeva kupito bhavati. I think in my last presentation I gave an example that किसी छोटे बच्चे को वो अपने आप खेल रहा होता है, इधर उधर दौड़ता है रूम में. Once you hold him tightly or you tie him to some sofa or something so that he cannot run, he starts screaming, crying and getting angry. So Vayu also like that only. Vayu is happy when it is freely moving. Vayu is happy, cheerful, it's when freely moving. Once Vega Pratibandhat, एक बार उसका वेग में प्रतिबंध उत्पन्न हुआ, किसी ने उसके वेग में बाधा डाला, then कुपितो भवति, वो गुस्सा हो जाता है. This is the concept of avarana. And here, I'll further classify that. Many confuse the concept of Gatavata and Avratavata. But it's very easy. Because Gatavata is what? Vata will travel to certain specific sites like Dosha, Dhatu, Upadhatu, Ashaya, etc. That is called as Gatavata, like Pakvashaya Gatavata, Rakta Gatavata, Sandhi Gatavata, and so on. Whereas in Avarana, see, there it is movement. But in Avarana, the Vata dosha's movement itself is hampered by the other doshas, Dhatus and Malas. Freely moving healthy Vata will not cause any problem because it is freely moving. It will not cause any problem. Once its Gati is hampered, it gradually aggravates and causes a disease. Avarana to mask or to obstruct. Chala is the unique feature of Vayu. This all we know. Now, third line is very important. Please listen carefully. For Avarana to manifest as a special pathogenesis, for an Avarana to manifest as a special pathogenesis, the Avaraka must be relatively stronger than the Vata dosha. That's what. अगर आप बच्चे को पकड़ रहे हैं तो बच्चे से आप स्ट्रांग होना चाहिए. अगर बच्चा आपसे स्ट्रांग है तो वो will definitely get rid of your grip and he will वो निकल जाएगा. Okay, बच के निकल जाएगा. Means he will fight and he will restrict and he will just, if he is more stronger, he will definitely get freed from your arms and he will run away. That is why the very important concept of basic understanding of Avarana is Avarana symptoms to manifest, the Avaraka should be very strong relatively compared to the Avaraka, Avrata, Vata. So if the Bala of Vata dosha is overpowered by the Bala of Avaraka, then only Avarana occurs, or else it's very difficult to restrict the mighty Vata dosha. Mighty Vata dosha. Hence, the disorders of Avrata Vata are produced by indulging in etiological factors of Avaraka for a long time. See, now this line is important that the only disease of Vata Vyadhi where you will not find any Nidanas of Vayu. I repeat, the only disease or the only concept of pathogenesis where you find the Lakshanas of Vata without being involved in the Lakshanas of Vata. Because Nidanas Vata ke nahi hai. Nidanas are of the Avaraka. But Vata is spreading the symptoms because it is covered, it's obstructed. So types of Avarana we know. There are 42 Avaranas. Total number. Pitta 1, Kapha 1, Rakta to Shukra and Sarva Dhatu Avarana is 7. Purisha is 1, Mutra is 1 and Anna is 1. So these are 12 Avaranas of Murta Avarana. See, Avaranas of 2 types. Basically, Avaranas are grossly 2 types. Murta Avarana and Amurta Avarana. Murta Avarana means something which has Murti shape like Pitta, Kapha, Rakta to Shukra and Sarva Dhatu, Purisha, Mutra, Anna. These all can be having some shape. Coming to the Amurta Avarana, 20. That is Anyonya Avarana. Another 10 Amurta Avaranas are Pitta Avarana of 5 subtypes of Vayu and Kapha Avarana of 5 subtypes of Vayu. That is Pitta Avrata Prana to Apana, Kapha Avrata Prana to Apana. These are also 10. So 12 and 10, 22 are Murta Avaranas and 20 are Amurta Avaranas. That totally 42. According to Chakrapani, excessively increased strong Avaraka, excessively increased strong, that is very Balavan Avaraka, suppresses the normal actions of Avrata, that is Vata. But excessively increased Avaraka manifests its symptoms, Karma Hani of Vata, Karma Ruddhi of Avaraka. This is the basic understanding as per Chakrapani. Further, the same thing in the words of Chakrapani, Atra Avaryanam Baliyasa Avarnat Swakarma Hanir Bhavati, Vata Karma Hanir Bhavati, आवरकस्य कर्मवृद्धिर्भवति आवरकस्य तु उत्सर्गः तथा आवरणेन च आवर्यः प्रकुपितो भवति तदा स्वकर्मणां वृद्धि भवति इति व्यवस्थाः अन्ये तु आवरणीयस्य स्वकर्महानि आवरकस्य तु उत्सर्गतो सेम थिंग आवर्त आवरणीय और आवृत कर्महानि वात कर्महानि आवरक पित्त कफ मल दोष एक्सेट्रा धातु is karma utsarga. This I told. Prakopa of Vayu without its own causes. Because avaraka causes are there. When Vata Prakopa, gradual avarana of the avaraka starts, accumulation of avaraka occurs only when the patient indulges in the hetu of that particular avaraka, in pitta, kapha, dhatu or anything. Hence, avarana there will be no history of any Vata Vardaka Ahara Vihara Sevana का हिस्ट्री नहीं मिलता. On the other hand, the history of the avaraka is found. Based on this, it can be inferred that avarana condition, vata disorders are produced with all involving the hetu of vayu. Symptom complex in avarata vata. Often the symptoms manifested are comprised of disturbed functions of the obstructing substance as well as the obstructed vata. Like if you see Ashtanga Sangraha Nidanasthana, 16th chapter and 47th shloka. I didn't mention the shloka, I just repeated the words there. Based on these principles, there will be three things you can notice. That is, one is Karmahani or Rupahani, Rupa Vriddhi or Karma Vriddhi, and Rupantara. Means you may see some symptoms which are not specific to Avrata or which are not specific to Avaraka. There may be Rupantara. Means it's like a mutation. It's like a modification. You may see some symptoms. This is Ashtanga Sangraha for you. This complex clinical presentation produced by Avarana is always a diagnostic challenge. 100%. It's a diagnostic challenge. To identify the precise cause, the exact pathogenesis of Avarana requires a special diagnostic skill and expertise. So you should be a very skilled Vaidya or expert Vaidya to understand this concept. Sometimes it misleads to a physician because of its complex, atypical presentations. Now look at this. First chapter of Siddhisthana, Charaka Samhita, Kalpana Siddhi Adhyaya. So beautifully a shloka comes there. Because why this shloka came there only? Why not in other Sutra Sthanas, Chikita or in Vata Chikita? Because we are discussing the basic principles of Panchakarma in Kalpana Siddhi Adhyaya. If you look at the shloka, you will understand why this shloka, particular shloka is included in Siddhisthana only because, see, Meda Kafabhyam Anilo Niruddaha Avarana. Meda Kafabhyam Anilo Niruddaha. If Meda and Kafa are doing the Avarana of Vayu, symptoms are Shula Angasuptibhi Shwayatun Karoti. Dekho, Shula Vayu, Angasupti Kafa Meda, Shwayatu again Kafa Meda. And even Vata also, because Vata Shota is there, Kapha Shota is there. When a doctors understand by seeing the patient that, okay, this patient is having Shula, Angasupti and Shota, Sneham tu Yunjan Abudastu. See the word used by Charaka, Abuddha. Non-intelligent. Confused Vaidya. ये सारे symptoms को देख के, if you use Sneha by ignorance. Abudha means what? Ignorance. तस्मै ही संवर्धयत्येव ही तान विकारान. वो symptoms बढ़ जाएंगे. Because you have misunderstood because of your ignorance that it's a kevala vata vyadhi, but actually what it is the avarana caused by the med and kapha. And उस condition में अगर आपने स्नेह use किया तो med kapha increase हो जाएगा और vata symptoms बढ़ जाएंगे. संवर्धयत्येव ही तान विकारान. रोगास्तथा अन्ये अपि वितर्क्यमानाः परस्परेण अवगृहीतमार्गः. See again this paraspara avagritha because you are using wrong sneha for the kapha meda avrata vayu, there anya rogas will also be produced. Sandushita dhatu bireva channehi swabhashajye na upashamam vrajanti. So the basic importance of this shloka is that you have to be very cautious while treating avarna. Same thing happens in Vrustambha. Same thing happens in Amavata. Because the Upashaya of Amavata itself is apply the sneha and see if the symptoms aggravate, it is Amavata. If the symptoms reduce, it is Sandhivata. So, Avarana, you have to be very cautious that a beautiful line told by Charaka is Pariksha Karano Kushal Bhavanti. You have to do Pariksha. Rogamado Parikshayeta Tato Anantaram Aushadam. Pariksha is very important. That is why it's very difficult to practice Ayurveda by learning Ayurveda. By learning Ayurveda to practice allopathy, it's very easy. But I call it is a challenge for the students to practice Ayurveda by learning Ayurveda because वहाँ पे तो क्या है antibiotics, anti-inflammatory, analgesics and anti-inflammatory देंगे, उससे acidity होगा, फिर एक pantoprazole देंगे, very easy. But यहाँ पे आपको दोष, दूष्य, दशविध परीक्षा, अष्टविध परीक्षा, अंशांश कल्पना, इतना you have to be so deeper and यार इतना कौन करेगा, very deep. That's why, and avarana over that is very enigma also. So we have to be very perfect learners of samhitas to practice any concepts of Ayurveda to understand it clearly. Now, how to diagnose? There are some rules given in different concepts, even by Charaka, Shushruta and Vagbata. I have collected everything so that it will be helpful for the students. See, Kshaya, Vruddhi and Gatatva are the three conditions to be diagnosed with the help of symptomatology mentioned in the text. Kevalo Doshayuktava, Dhatopi Avata, this shloka I already told from the Shushruta. Now, however, Avarana requires a special diagnostic skill because of its complex presentation. Sushruta mentions that conditions may be pure vata, conditions may be samsarga vata, or conditions may be avrata varga. Sometimes, this line is important. It may not be possible to diagnose the avarana and anyonya avarana directly. In that case, you have to take help of the exclusion method. How is the exclusion method? Just now I told. Simple examples. When you want to differentially diagnose Amavata, Sandhivata and Vatarakta, and just taken Vatarakta just for some making one disease extra, inclusion method and exclusion method. No, you want to diagnose Sandhivata Vata, then you say it is a unilateral, it is a single joint, it is not multiple joint, there is no morning stiffness, there is no inflammation, there is no like calor, dollar, pain, etc. Sandhi Shota is not there. Whereas in Amavata and Sandhivata, exclusion method is, as I said, you apply oil. If the symptoms persist and aggravate, you think it is Amavata. And if the symptoms reduce, you think it is Sandhivata. If nothing happens, something more enigmatic symptoms are there, then you go for Vatarakta, that is Anyonya Avarana. Rakta Avarana of Vayu, Vayu Avarana of Rakta. So there, the treatment may be Rakta Moksha needed there. Because when you cannot manage a disease by Shadupakramas, even in Vidishonitya and in Charaka Chikitsa 3, that is Jara, this shloka has been given. Shitoshna Snigdhader Yasya Na Shamyati. Shitoshna Snigdhader Yasya Na Shamyati. Sita, Ushna, Ruksha, Snigdha. लघु गुरु, 6 गुणास, 6 उपक्रमास. जब भी कोई डिसीज षडुपक्रम से ट्रीटमेंट पॉसिबल नहीं है, then you understand that doshas are shakanusari and go for Mokshana. So there you need a brain to differentially diagnosis. In Ashtanga Hridaya, same thing. He mentions that sometimes it's very difficult to diagnose the condition of Avarana. And in that case, it requires repeated clinical examination. Mishraihi, Pittadibis, Tadvat, Mishranapirinekadaha, Taratamya Vikalpachya. See, Taratama Vikalpachya, Yati Avrata Asankhyatam. Taratama bhav se Avarana Asankhya hote hain. Not only 42, there will be innumerable because we just saw Pitta, Kapha, Vrata, Vata, Pitta, Kapha, Vrata, Prana, Udana, Samana, Puta, Apana, but Pitta, Vruddha, Pitta, Vruddhatara, Pitta, Vruddhatama. How many? Taratamya Vikalpachya, Yati, Avrataihi, Asankhyatam, Tam Lakshayet Vidaho, sorry, Tam Lakshayet, Avihito Yatasam, Lakshanodyat, Shanaihi Shanaihishcha, Upashayat, Gudamapi, Murmuhu, Shanaihi Shanaihi. Thode thode samjhiye. Little by little you try to understand by understanding the Gudalingas, deeper secret symptoms, Muhur, on and off and pariksha is very much necessary to understand the Avarana. This is told by Ashtanga Hridaya. Now principles of treatment. General management. General principles of Vata Pakrama we applied due to care of obstruction of Vata and Shotas by Pitta and Kapha. The Avarana should be treated by the measures which are Anabhishandi, see the word, not Abhishandi, Anabhishandi, non-obstructive, Snigdha, unctuous, and Shoto Shuddhikaraka. First Anabhishandi because you have to remove the Avaraka first. Then andar kaun hai? Andar Vayu hai. To Snigdha. Then Shoto Shuddhikaraka. Dobara obstruction na ho, then you go for Shoto Shuddhikaraka Chikitsa. That's why Panchakarma is very much important. In case of Vata is obstructed, at all the places, that is Sarvasthana Avarate, Ashu Chikitsa, which regulate Vata and at the same time not viruddha to Pitta and Kapha. Very important. That's why Avarana Chikitsa is difficult. देखो आपको क्या करना है? Quickly you have to manage Vata by anti-Vata treatment. At the same time, that treatment should not be anti-Pitta and anti-Kapha also. So very carefully you have to manage. This is in Charaka Chikitsa 28, shloka number 239. Kapha Pitta Avirodhi cha. In this condition of Pitta Vrata Vata, I mean, an example I'm giving you, the treatment of Pitta, which is not antagonist to Vata, should be prescribed. For example, if I ask many students who are there in the presentation, your answer will be Madhura only. Only Madhura. Why? Because if you take Tikta Kashaya for the Pitta, Tikta Kashaya will increase Vata. ओके सर पित्तावरण है तो हम शीत चिकित्सा करेंगे, शीत से बात बढ़ जाएगा. दैट्स व्हाई सोच के मैंने एक ही आंसर दिया मधुरा, बिकॉज अमॉन्ग द पित्त शामका 3 rasas and 1 guna, that is Shita guna, the only possible treatment for both Vata and Pitta are Madhura only. That's why Madhura is Vata Shamaka, Madhura is Pitta Shamaka. That is the wise choice for Pitta Vrata Vata. And in the condition of Kapha Vrata Vata, absolutely, if you treat Kapha by Katuchikta Kashaya, quickly it will increase Vata. And if you treat Vata by Madhuramla Lavana, quickly it will increase Kapha. So यहाँ पे only one life-saving guna is Ushna. Because Ushna is the only guna which will treat both Vata and Kapha at a time. I don't say Ushna as a temperature, Ushna may be Viri also. So that is why for a Chikitsaka to be successful in clinical practice, the most required knowledge is guna. like Dravyaguna, not Dravyaguna subject, of course, because Dravyaguna subject deals with Dravya and Guna. So you need very much knowledge of Dravya and Gunas. Now, how to take the sthana care? The Visheta dosha attains great strength. Very clear. When it is situated in its natural function seat. That means अपने स्थान में सब लोग अपने राज्य में हर एक राजा होता है. If you go to other places, nobody will recognize you. Hence, first treated by suitable medications such as Vamana, Virechana, Basti, and Svedana. Again, Charaka Chikitsa 28 or 98. Now, Shodhana therapy, depending on the strength of the patients. Like if you see Rakta Pitta, if you see Atisara, Akshina Bala Mamsasya, means the patient should be fit for Shodhana. अगर वो वीक है, धातु क्षय है, अग्नि क्षीण है, then Shodhana is not possible. Madhura Anuvasana or Yapana Vasti, Mrudu Virechana should be administered. These two are mentioned in Charaka Chikitsa 28 to 40. Now, Rasayana therapy. When everything is done to re-establish the strength of the patient, clearly Charaka has mentioned at the end of Avarna Chikitsa, Rasayana, especially Prasamiksha Baladikyam Mruduva Sramsanam Hitam, Rasayanam Sarvesham Upayoga Prashasate, Shailasya Jatu, Shilajatu, and Gugulu. Wonderful two drugs for Avarna, Shilajatu and Gugulu. You use Chandraprabhavati, you use Shilajatu Adivati, you use Yogaraja Rasayana, not Yogaraja Gugulu. Okay? And Gugulus are many, like Yogaraja, Mahayogaraja, Kaishwara, Trayodashanga. Okay? So Vatari Gugulu, Rasadi Gugulu, any Gugulus are there, but you have to be very cautious and very clean in diagnosis that whenever you want to give Rasayana, two Rasayanas mentioned by Charaka are Sailasya Jatu, Atyartam Payasaha, Gugulus Tataha, Atyartam Payasaha, with abundance of milk you have to give. Last line he says one more Rasayana, Bhargava Prokta Rasayana. क्षीर बंगु नराहा, क्षीर भुक नराहा, क्षीर भुक नराहा, मतलब दूध के साथ साथ भार्गव प्रोक्तम अभ्यसेत. So Brahma Rasayana, Chavanprasa Rasayana, Bhargava Prokta Rasayana can be given. These are the Rasayana. Okay, so I'll just skip it. Now, coming to the second part. How to understand the complex examples of Avarna in certain diseases. The first and foremost and very practical you see in your day-to-day life, because India is the capital of the world of diabetes. Now, looking into the concept of Prameha, again, Prameha is also having two pathologies. If you look into Charaka Chikitsa 6, you will understand the deeper meaning of pathogenesis. Kaphaja, Pittaja, Vataja, three sampraptis are given in just 2 lines. In Vataja Pramehas, you usually find Dhatu Kshayakaraka Nidanas. Like if you see the Prameha Nidana Sthana, 4th chapter, Charakat Nidana Sthana, all these Nidanas mentioned. I will not take time to read it. Okay, we are already half an hour end of this process. Kashaya, Katutikta, Ruksha, Lagu, Shita, Vyavaya, Vyayama, all these are Dhatu Kshayakarakas. Okay. Now, this is not our important point. Our important point is this one. And see the fun. This is neither mentioned in Nidanasthana, neither mentioned in Chikitsasthana. This is mentioned in Sutrasthana. At that too, Kiyanta Shirsi Adhyaya 17. Kiyanta Shirsi is mentioned. That is the first of Roga Chatishka. Why? Because there in the concept of Pidakas, Sapta Prameha Pidakas, there Acharya Charaka wanted to explain विशेष करके पिड़काओं में या फिर स्थूल प्रमेय में when you see pidakas, because for pidaka to happen there should be dushta mamsameda, whereas in prusha prameyi mamsamedas are gone. So I don't mean to say that prameya pidakas occur only in stula prameyi, but majority in stula prameyi. In that concept only, in the Kiyanta Shirsi Adhyaya, Charaka explains a beautiful concept of Avarnajanya Samprapti in Prameha. Let us see the shloka 78 to 80. Guru Snigdha Amla Lavana. देखो यहाँ पे कषाय कटुतिक्त रुक्ष लघु शीत, यहाँ पे गुरु स्निग्ध आम्ल लवण, एग्जैक्टली ऑपोजिट. लवणानि अतिमात्रम समश्नताम, समश्नताम मिलके खाना, या फिर पत्यापत्य यह एकत्र यो भुंजते, ग्रहणी, ग्रहणी लास्ट. इफ यू ईट पथ्य एंड अपत्य टुगेदर इट्स कॉल्ड एज समशना. दोनों को ले सकते हैं. नवम अन्नम च पानम, सी नवम अन्नम, न्यूली हार्वेस्टेड ग्रेन्स. नवपानम, नवोदक वर्षानादेय जल or newly fermented alcoholic preparations are guru in nature. Okay, so Navina Madhu is also guru, Purana Madhu is Lekana, Lagu Ruksha. So Navapana means any drinks which is new. Nidram Asya Sukha Nicha, Nidra Sukha Asya Sukha. This is there in the Nidana Sampraptya Pramein Chikitsasthana also. त्यक्त व्यायाम चिंतानाम, जिसने व्यायाम और चिंता को बिल्कुल छोड़ दिया है, means he never has any chinta and he never does any physical activity. त्यक्त व्यायाम चिंतानाम संशोधनम अकुर्वताम. अब ऋतु के हिसाब से, as per the ऋतु, this person is never getting ऋतु शोधना and not at all taking any samshodhana in spite of having bahudoshavastha in the body. Sleshma pittam cha medascha mamsam cha ati pravardayeta. See, all these nidanas, first three lines. When a person indulges in too much nidanas of these, Guru Snigdam Lavana, Navana, Navapana, Nidra Sukha, Swapna Sukha, Asya Sukha, no Vyayama, no Chinta, no Shodhana, then what happens? Kapha, Pitta, Meda, Mamsa cha ati pravardayete. It will increase too much. So these what they will do? Taihi avrta gatir vayuhu ojo adaya gacchati. These obstructing the path of Vayu will obstruct in turn Vata's path, and Vata aggravated may take the Oja towards the Basti. So this is only concept of Ojo Meha or Madhumeha. And in the commentary, Madhumeha has been mentioned as a Samanya word for synonymous of Prameya also. So don't think that it's only the Samprapti of Madhumeha, it is the Samprapti of Avaranajanya diabetes. That means it is not Dhatukshayajanya Prameha, it is Avaranajanya Prameha. Yada Bastim Tada Kruchro Madhumeha Pravartate. So in this concept, when Oja starts going out, this is one simile they have given. This leads to Madhumeha. Now, how to understand Avarana in Madhumeha? If I ask if it was a live class, I would have enjoyed, because interaction will be very much possible to the students. Especially UG students and PG scholars, if I ask, is there a chance of existence of hyperinsulinemia with hyperglycemia together? Maybe more than 50% or 60-70% people will say, how it's possible, sir? एक ही आदमी में इंसुलिन भी बढ़ा हुआ रहेगा और शुगर भी बढ़ा हुआ रहेगा, कैसे पॉसिबल है? पॉसिबल है when it comes to insulin resistance. This concept of insulin resistance and insulin receptors mechanism, how insulin enters into the cell, how glucose enters into the cell, this is all, it's a basic, you should study this. I will not waste much time here, but I will definitely tell you the hidden meaning of this one. Pancreas is producing insulin, that is the beta cells, insulin and glucagon, alpha and beta cells. So insulin is produced properly in a person, but because of kapha meda avrta, pathology of Vayu, the produced insulin cannot enter the cells because the insulin receptors at the cell membrane are hampered, become unhealthy, or they are blocked. This concept is called as insulin resistance. So daily insulin is produced but not utilized. Insulin is produced, not utilized. Again insulin is produced, not utilized. What happens? In the body, in the blood, serum insulin goes high. And when insulin is not utilized, whatever the patient is eating, the glucose is not metabolized. So there will be together presence of hyperinsulinemia with hyperglycemia. glycemia. This is what we see in type 2 diabetes. So here, nowadays, I'll show you some so-called endocrinologists and diabetologists are giving insulin for obese patients also, which I think it's a crime. They might have a number of reasons to substantiate it. But according to Ayurveda, Sthula Pramehi needs Shodhana. Krusha Pramehi needs Sambrahmana, and Sambrahmana, insulin is a anabolic hormone. Go search your internet right now with your, if you have mobile with you, search internet, ask your Google Guru, what is insulin? Insulin is a anabolic hormone. It will increase. That is why insulin is relatively given only for the insulin-dependent diabetes, which are actually close to Krusha Pramehis. Now look at this insulin resistance. This insulin resistance happens when cell in the muscle and fat and liver stop responding well to the hormone insulin. Okay, so the hormone insulin secreted by the pancreas will not be responded by the muscle, fat, and liver. This occurs due to chronic high insulin levels from constant sugar and carb intake. Dekho, constant sugar and carb intake. Navannapanam Gudavekrutam. See, carb intake. Now look at these two words. I have put it in red. Low grade inflammation, number one. Low grade inflammation. And number two, most important, please keep this in mind. Fat buildup inside cells. Fat buildup inside cells. What is fat in Ayurveda? Meda. What is unhealthy fat in Ayurveda? Bahu Abadda Meda. Right now, open if you have Charak Samhita, Nidanasthana, there the major culprit in Prameha is Bahudrava Sleshma, Dosha, and the major culprit Dusha is Bahu Abadda Meda. Bahu Abadda Meda. How amazingly Charaka has told what now in 21st century, the modern science is saying that insulin resistance occurs because of fat buildup inside the cells. अच्छा ऐसा बताए तो साइंटिफिक है और बहु अबद्ध मेद बोले तो अनसाइंटिफिक है. This is the fate of Ayurvedic students, that we are blindly following a science which is nothing but explaining the concepts mentioned in Charak Samhita in English in 21st century. हजारों साल पहले जो आचार्य अग्निवेश आत्रेय जी ने जो बताया था उसी को 21st सेंचुरी में अगर आप इंग्लिश में बोलेंगे तो वो साइंटिफिक हो जाएगा, ऐसा नहीं है, तो मूर्खता है. Here clearly I am telling you the modern concept that it is low grade inflammation and high buildup of fat inside the cells. Now what is fat inside the cells? Let us see. This blocks the internal signaling pathways. देखो ये जो inflammation और fat buildup है वो कवर कर लेगा. किसको कवर करेगा? रिसेप्टर्स को कवर करेगा. And what happens? There is a block in the internal signaling pathway. Red light signal. Don't enter. Who? Insulin. कहाँ पे एंटर नहीं करना है? सेल में एंटर नहीं करना है. There is a red light for the insulin to not to enter into the cell. This is the failure of insulin receptors, and that will never let the insulin inside, and also internal signaling pathways that normally let glucose inside. So glucose भी अंदर नहीं जाएगा, इंसुलिन भी अंदर नहीं जाएगा, दोनों यूज नहीं होंगे तो सीरम में दोनों बढ़ेंगे, ग्लूकोज भी बढ़ेगा, इंसुलिन भी बढ़ेगा. That's why in obese diabetics, stula pramehis, you usually find hyperinsulinemia with hyperglycemia. Now look at this fat buildup. This is from Ashtoniditi Adhyaya. And this shloka is the concept of Staulya, Atistaulya. Okay, तो पूरा श्लोक नहीं पढ़ूंगा. Clearly he is told, मेधसा आवृत मार्गत्वाच्च कृच्छ व्यवायता शुक्र अबहुता in the upper slide, upper picture. नीचे भवन्ति च अत्र मेधसा आवृत मार्गत्वात् वायुः कोष्ठे विशेषतः. Here also avarana of vayu by the meda. Charan Sanduksheti Agnimaram. This is the concept of Atikshuda and Atitushna in Stavlya. So that means Ayurvedic acharyas had the knowledge thousands and thousands of years ago before the concept of type 2 diabetes that the major culprit in Prameha is Meda. The major culprit in Prameha is Meda because it's doing the Avarna. Look into this. How you can decode Charak Samhita with the concepts of modern science. If you look at the free radical concept, I have put vis-a-vis AMA. अरे सर ये क्या पागलपन है मतलब आम कैसे फ्री रेडिकल हो सकता है कुछ लोग पूछ सकते हैं नीचे देखो मधुकोश कॉमेंट्री ऑफ मादा निदाना आमवत निदाना आमम अनरसम केचित तो मल संचयम प्रथमम दोष दृष्टिम केचित आमम प्रचक्षते this shloka is there in the Madhukosha commentary of Madhanidana 25 Amavata Nidana. See, Ama Mandarasam Kichit, that is Ushman Alpa Balatva Dhatumadim Pachitam is also called as Ama. Second point, Mala Sanchaya. Mala is not Mutra and Mala, Purish aisa nahi hai. Metabolic waste is also Mala. Ushman Alpa Balatva metabolic waste. So these metabolic wastes in the body, when they collect, are also called as Ama. And Pratama Dosha Dushti, Sanchaya Avastha, Sanchaya of Doshas, Dhatus and Malas is also Ama. There are Trivida Ama. Now look into this picture. If you look into this molecule, there's a nucleus, and in the first picture, that is the blue picture, there are 10 electrons. There are 10 electrons, whereas in this, there are 9. This missing electron is called as a free radical. This missing electron is called as free radical. So this free radical, why the word free? Free means it is not bound to the orbit. Try to understand, it's very easy. It is not present in the orbit. So when it is not present in the orbit, what happens? It is free to move. When it is free to move, oxidative stress. Normal cell, free radical attacking cell, and cell with oxidative stress. When it is free to move, free radical, it will be trying to circulate all over the body, finding a partner for neutralization. Try to understand, electrons are negatively charged. So this will be circulating all over the body, finding a reactive oxygen species, ROS, to neutralize. Wherever it finds a nascent oxygen, what you call the ROS, there it attains oxidation, and that leads to oxidative stress. Wherever it gets oxidation species, it gets oxidation, and there is called as oxidative stress. ये मॉडर्न कॉन्सेप्ट हो गया. हजारों साल पहले हमारे आचार्यों ने एक श्लोका बोला है, कुपितानाम हि दोषानाम शरीरे परिधावताम यत्र संगः ख वैगुण्यात् व्याधिस्तत्रोपजायते. कुपितानाम हि दोषानाम, ये मिस्ड इलेक्ट्रॉन, कुपितानाम हि दोषानाम, मिसिंग इलेक्ट्रॉन कुपित हो गया क्योंकि इसको पार्टनर नहीं है, एंग्री हो गया. ये क्या कर रहा है? इट इज मूविंग ऑल ओवर द बॉडी ट्राइंग टू फाइंड द ROS, रिएक्टिव ऑक्सीजन स्पीसीज. जहां पे भी मिला यत्र संगः ख वैगुण्यात्, वहां पे ऑक्सीडेटिव स्ट्रेस करके द सेल इज डैमेज्ड. ख वैगुण्यात् व्याधिस्तत्रोपजायते, ऐसा बोलेंगे तो साइंटिफिक दिखता ही नहीं हमारा आयुर्वेद हमारे लोगों को. So I say that we people ourselves destroy our science thinking that it is not scientific. Everything in Ayurveda is scientific. Look at this. My own patients, you can see my name where there's reference here. Total insulin, serum insulin normal is 2.6 to 24.9. You can check online. This patient of diabetes given 3 times insulin, 12 units, 14 units and 10 units. 3 times, सुबह दोपहर शाम को. And his serum insulin is 31.2. His weight was 90 kilos. Height of foolishness. Stula Pramehi, endocrinologist given 3 times insulin. And his insulin is 31, more than normal. Second patient, 39.7. This was the mother of my PG scholar. Different department. Okay, I should not tell the name. So I just put a mark on the name. नॉर्मल इंसुलिन से ज्यादा बड़ा हुआ 39.7. थर्ड वन, होल्ड योर ब्रेथ. Look at this. Serum insulin, my own patient. Forget about 30-40. यहाँ पे तो 113.8. 113.8. Normal is 25. And look at the creatinine, 2.36. That means this patient is already going into diabetic nephropathy. And you will not believe, again the endocrinologist had given 20 units in the morning, 16 units in the night for this patient who has 113.8 insulin. That's why I said I'm sorry to use the word foolishness, because इन लोगों को आवरण की कॉन्सेप्ट पता ही नहीं चलता है. The people have not learned anything like avarna. That's why here only shodhana is necessary, not to give insulin. Body में already insulin इतना ज्यादा है. Allow the body to use it. Remove the avarna. Do shodhana. स्थूल प्रमेहि बलवानिकया कुशस्ततेक दुर्बलस्य च संब्रह्मणं तत्र कुशस्य कारं शोधनम दोष बलादिकस्य. शोधन करना जरूरी है यहाँ पे. If you do shodhana like vamana virechana, then only you can remove the avarana so that your body insulin produced is utilized by your cells. Otherwise, if you go on giving insulin blindly, you are killing the patient. Actually, you are killing the patient slowly, because this patient has 113 insulin. And nobody does this. Nobody does this. कोई भी endocrinologist serum insulin नहीं करा था. ये मैं करा रहा हूँ, because in my mind it came that let me see the insulin levels, why these people are giving. Now this patient went and fought with the endocrinologist. That endocrinologist literally said that, who did this test? Then they saw this report and you said, get lost, go to the doctor only, don't come to me, because he doesn't have any answer. पेशेंट ने नम्रता से पूछा, रेस्पेक्टफुली पूछा, सर इतना इंसुलिन मेरे बॉडी में बढ़ा हुआ है, फिर भी आप इंसुलिन क्यों दे रहे हो? गुस्सा हो गया. नो आंसर. दिस इज happening when you don't understand avarana. That's what I told in the Kalpasthana, that kapha meda vrata vayu, if you are doing snehana, the symptoms will increase. That's what is happening here. Now see the prognosis. Beautiful words. Samakriyatvat, Vishamakriyatvat, Mahatteyatvatcha, Chikitsa. 6. Sadhya Sadhata. Kapha is Sadhya, Pitta is Yapya, Vata is Asadhya, because the word used is Samakriyatvat, Vishamakriyatvat, Mahatteyatvatcha. Because you have to understand Chikitsa. See, Samakriyatvat means Kapha Meda, Dosha Dosha. दोनों को हम कटुतिक्त कषाय से कर सकते हैं. चक्रपाणी कमेंट्री. समक्रियत्वात् इति कफस्य दोषस्य दोषस्य मेद प्रभृते समानत्वात् कटुतिक्त क्रियाः. विषमक्रियत्वात्, if you want to treat pitta, katu is for meda, but katu will increase pitta. Ushna for meda is okay, Ushna for pitta is not good. That's why Vishamakriyatvat. And look at Mahatteyatvat, because मज्जादिभिर गंभीर धातु अपकर्षत्वेन मज्जामेह, वसामेह, लसिकामेह, ओजोमेह. गंभीर धातु is going through the urine. That is why महाव्यापत्ति कर्तृकत्वात् आशुकारित्वाच्च. It is impossible to treat. Which one? Vataja prameya. That's why we say stula prameya kapha, because kapha is thaulya, vata is krisha. NIDDM is kapha, IDDM is vata. Very closely. मेरे सेंटेंस को ऐसा ही मत लेना. I'm just comparing, trying to correlate, but I'm not telling that it is 100% NIDDM is kapha and IDDM is vata. Not like that. In the Chikitsa Prameya, that's what I told. Stula Pramehi Balavanekaha Krishastateka Paridurbalascha. Look at the yellow color what I am marked. Samshodhanam Dosha Baladikasya. What Samshodhanam? Urdvam tata adasya male apanite meheshu santarpaneveva karyam. Urdvam apaniyate means urdvam vamanam ada direction. And in Prameya Chikitsa again at the end, that is in the 25th shloka, Samshodhana ullekana langanani kale prayuktani kapha pramehan. Vamana virechana is both told. Langana is also told in kapha prameha. Jayanti pitta prabhavan virekaha santarpana samshavanam vidishch. Virechana for pitta, ullekana and langana for the kapha. Acharya Sushruta goes further, because what will be Prameya Chikitsa hai in Chikitsa Sana 11. Here, when Charaka says Vamana and Virechana, Acharya Shushruta goes further one step again, saying that Vamayet Pragadam Virechecha. Pragada Virechana means Dikshna Virechana or deep Virechana. Virechanad Surasadi Kashayana Asthapayet. See, Basti is given. Surasadi Kashaya. Surasadi Varga, you go and say Shushruta. Mahaushada, Badradaru. Mahaushada, Shunti, Badradaru, Mustavapena, Madhusainda Yuktena, Avapena, Madhusainda Kalka. Which is the Kalka? Shunti, Badradaru, Musta is the Kalka. Madhusainda Yukta, Kashaya is Surasadi Kashaya. Dahyamanamcha, if the patient has Daha, which is that diabetic neuropathy. Negrodadi Kashayana, Nistailena. See, Negrodadi means Panchavalkala. Negroda Udumbara Ashwata. Negrodadi Gana, Kashaya Siddha Taila, you can go for Basti in case of Dahyamana. Apply भी कर सकते हैं, Basti भी दे सकते हैं. This is in the diabetic neuropathy. In the Nibandha Sangra Vakya of Dalana, Paitikeshu tu Meheshu Pittameha Virechayet, Amashayeste Kapapitte Vamayet. Dekho, very clear. Pittacha Prameha Virechana, Amashayesta Kapapitta Umana, Pakvashayesta Pitta Virechana. Virechana Nantaram, Saptaratan Parato means you know that you have to go for Samsajana Krama, etc. Basti is also told for Prameha by Sushruta. Second disease, Urustamba. Again, the only disease where Panchakarma is contraindicated. Look at Samprapti. Rudhva Ashu Gauravat Uruhu Yati Adoge Sirabihi Medo Balotkataha Tadvat Urugata Kafaha Gauravayasa Sankocha Daha Ruksupti Company. I am reading only the yellow colored marked ones. Means Gauravat Uru because of heaviness. Kaunsa Gaurava Kafa Meda is Guru. That's why they go deeper into the Uru. Medo Balatkataha. Meda is strong here. Urugata Kafa is there. And look into this loka. Vata Pishankibir Adnyatam Urustamba. Shloka number 16. Meda Kafa Avarna. Urusan Samshraya. Symptoms immediate Avarna. Not indicated for any Panchakarma. Only disease. If you look into the Urustamba Shloka number 16, Vata Shanki, Shanka, doubt. चिकित्सा करते वक्त अगर वैद्य डाउटफुली बिकॉज ऑफ इग्नोरेंस अज्ञानात तस्य स्यात् स्नेहनात् पुनः उस कंडीशन में अगर स्नेहन किया तो पादयोः सदनम सुप्ति कृच्छ्रात् उद्धरणम तथा symptoms will increase like pada supti pada sadana कृच्छ्र उद्धरण means the symptoms will be more difficult to treat. That is why अज्ञानात् तस्य word is used here. So same shloka is used in the Siddhisthana, first chapter, and same shloka is used in the Urustamba, where Avarna is a Gudalinga, where you are not confusing with Kevala Vata and doing Snehana, which will increase the condition of Avarna. So don't do that. Why I said Avarna? Because you see symptomatology. Jangoru Glani Ratyartham. Glani means tiredness. Janga and Uru becomes heavy and tired. It will not listen to the movements advised by the patient's brain. Shashvacha Daha Vedanaha, Ishajjaha Vedana means little bit Daha and Vedana is there. So Avaraka is there, which is producing Uruglani, and Avrata is producing Vedana. Patient cannot place the leg on the floor and also cannot tolerate the Shita Sparsha. Padam Chavate Denastam, Shita Sparsham na Vetticha. Vetti means cannot understand, cannot feel the cold touch. Again, neurological. Avarana. Samsthane, Pidane, Gatyam, Chalane, Chapinishara. Annineyo is Sambhagno means ये पैर मेरा है कि नहीं हो डाउट आता है अन्य नहीं हो किसी दूसरे का पैर है क्या बिकॉज इट इज नॉट लिसनिंग माय कमांड्स माय लेग इज नॉट लिसनिंग टू माय कमांड्स मींस अन्य नहीं हो किसी दूसरे का पैर है मेरा बात नहीं मान रहा है संभग्नो फ्रैक्चर हो गया यूज ही नहीं हो रहा है उरु पादो चमन्नते इफ यू लुक इनटू आवरण दाह अतितोदार्थो व्यपनम पुरुष भवेत् उरुस्तंभस्तदा हन्यात् साधयेत् अन्यथा नवम That's why here if you see samshamanam, kshapanam, shoshanam, because treatment is not given to vata here, treatment is given to kapha and meda avarana. That's why go for samshamana chikitsa, kshapana chikitsa, shoshana chikitsa, prukshana chikitsa, udvartana, pragada udvartana is told. Tarana against the flow of water, swimming against the flow of water, jumping from heights, running in uneven surfaces. Vyayama rupi chikitsa in Gurustamba. Please read, very interesting. Vyayama rupi chikitsa in Gurustamba. So all these are told for the removing the avarana of the kapha meda, because in the uru there is no opening to remove either by any panchakarma. That's why urustamba uru. From in the urustamba, panchakarma is contraindicated. Only rukshana, kshapana, shoshana, vatrakta. Okay, so the disease where two things are vitiated. Vata is vitiated, rakta is vitiated. This is the last one. Okay, because we are almost 15 minutes more. Organizers, please tell me if I should stop, because it's already 9:13.
So
Is it
we
okay?
have some questions as well, doubt session. Uh, it's actually very
So
interesting to hear. We cannot, we cannot stop you in the middle. It's very interesting to hear you out. So you can continue. We can have the doubt sessions later on, or we will collect the doubts together and send it to you, and send the answers in the group itself. That would be fine, I think.
yeah, no problem. I will need another 8 to 10 minutes. That's it. After it's
Okay.
over.
Okay, sir. Okay.
Okay. Here also the concept of Vatrakta is Avarana. And the only disease, I repeat, the only disease in Ayurveda where there is Anyonya Avarana is Vatrakta. No other disease there is Anyonya Avarana. Like, see the word. Raktena Vayu Viruddho Vruddhena Raktena Avaritapatihi. Avaritapatihi. Avarana of the path of Vayu. Raktamargam Nihantyashu Shaka Sandishu Marutaha Nivishya Anyonya. See the word in the 35th shloka of 29. Anyonya Mavarya Vedanabir Haret Asun. Anyonya Avarana is there. Now those who teach Vatrakta as gout, I'm very sorry. God bless you. You're doing a blunder mistake. Vatrakta is never gout. Vatrakta, clearly Charaka says, Rakta Margam Nihantyashu. There is obstruction to the marga of Rakta. So this is 100% vascular disorders, obstructive vascular disorders like DVT, Burger, TAO, transenzyme obliterans. Or okay, so I treat Vatarakta on the basis of vascular obstructive disorders. We get results, but gout is not Vatarakta. These are the symptoms like Karapad Anguli, Sarvasandeya, Krutva Ado, Hastapaditu Moolam Dehe Vidavati. This is the only confusing thing. Hastapado Moolam. So gout लार्जर टो मूलम, सो इसलिए वहां पे स्टार्ट होते तो गाउट हो गया. गाउट इज नॉट वात रखता, गाउट इज आमवाता. That is why when there is a collection of, there is obstruction for the path of rakta by the vayu, is nothing but air embolism. If rakta is doing the avarana of its own path, it is thromboembolism. Because unknown avarana is there. Vayu does the shoshan of rakta causing a clot. It's 100% true. Whenever your blood is exposed to the air, it means when there is a cut, there is a clot. So vata can do the shoshan of rakta to cause the thrombus, or vata in turn may become a bubble and do the air embolism. That's why यहाँ पे रक्त मोक्षण किया है, because to relieve the path of obstruction either by the Shrunga Jaloka or Suchi Alabo, etc. This is the deeper concept of Vata Rakta. I will not go into deeper this. Nirhared malam tasa sagrata kshira basti. See, kshira basti. Sagrata kshira basti. Nothing equals to basti. Nahi base samam kinchit Vata Rakta chikitsite. No other treatment is equal to basti chikitsa in Vata Rakta. Sagrata kshira basti. Again, sagrata tikta kshira basti can be said in particular because tikta is, even though vata increasing, but tikta is Shrota Shodhaka. Tikta is Amapachaka. So Kshira Basti and Grita will take care of Vayu, and Shodhana can be done by the Basti. Why Gudush is repeated again and again? Because look at this. Madhuparnyadi, Amrutadi. The answer is there in the Yajyapurushi 25, Sutrasthana, Amrita, Sangrahika, Vatahara, Deepaniya, Sleshma. Look at what I have marked. शोणित विबंध प्रशमना नाम, जहां पे भी रक्त का ऑब्स्ट्रक्शन है वहां पे गुडुची देते हैं. दैट इज वाई इन वात रक्त गुडुची इज यूज्ड अगेन एंड अगेन. मधुपर्णे आदि, अमृतादि, शतपाक मधुपर्णे, गुडुच्यादि, कैशर गुगुलु, ऑल गुडुची. नाउ इट्स वेरी क्लियर दैट शोणित विबंध प्रशमना नाम गुडुची, एंड वहां पे रक्त मार्गम नियंत्याशु इज संप्राप्ति. So how does gout? Gout is not at all possible. This is obstructive vascular disorders. That's why you have to give Guduchi here. Raktamargam niyantyashu. Shonita vibandha prashamanam. These two are the antagonist sentences. Conclusion. So to end in this 1 hour 15 minutes presentation, I have tried to attempt understand the unique concepts of Avarna by Vata, analyzing the textual references from different angles. Again, I say understanding applied aspect of Avarna is very important for diagnosis as well as Ayurvedic management. It's a very complex mechanism and needs logical interpretation and patience in diagnosis, not patience in diagnosis. The disease caused by Avarna can be managed by Shodhana, Shamana, and Rasayana. Thank you very much. Over to the organizers.
Thank you so much, sir. On the behalf of Nisargavedam Foundation, I, Dr. Rajat Verma, express our felt gratitude to Professor Dr. Sanjay Kadilamtti, sir, for delivering such an enlightening and inspiring session. Sir, your vast knowledge, clinical experience, and humble guidance have greatly enriched us. We are truly honored by your valuable time and support. We also extend our sincere thanks to all the participants for joining us with such enthusiasm and making this webinar a grand success. Your active participation and keen interest are deeply appreciated. A special word of appreciation goes to our team for their dedication and hard work in the making this event possible. I would request to participants to drop their doubts in the group, and we will send to sir all the doubts for clearance. Thank you so much. Thank you so much, sir, for your valuable time.
Thank you. I again take this opportunity to thank Nisargavedam Foundation. You all young guys are doing a wonderful job. And I have read that your intention itself is to spread knowledge to the needy people. And I wish you people continue this noble process of spreading knowledge. So once more, thanks to Nisargavedam for giving me opportunity to share my concepts of Avarna and Chikitsa. God bless you all. Thank you very much.
Thank you, sir. Thank you, sir.